Late nights, skipping the cleanse routine, going to bed with your makeup on. We can put our skin through a lot over the years. Thankfully, Cotia has combined Deer Milk with powerful actives to create skincare that genuinely keeps up with your lifestyle. And thousands of Aussie women are already obsessed. Keen to see what all the fuss is about? Use code MAMAMIA20 for 20% off your order. Cotia, because your skin deserves something extraordinary.
Welcome to The Kick, your expert-led podcast helping you explore and learn everything about getting pregnant, pregnancy, birth and becoming a parent.
On the podcast and our online pregnancy program, Grow My Baby, we share my experience of helping more than 4,000 babies to be born.
And our experience of running a women's health clinic and parenting 4 boys.
We're here to help everyone to feel empowered in pregnancy and birth with real-life practical information.
Welcome everyone, I'm Brigid Maloney.
And I'm obstetrician Dr. Patrick Maloney.
And today we are going to do an episode on when to expect your symptoms, if you're going to get a symptom, during your pregnancy.
Okay.
And we're going to talk about whether it's common or not, because often people ask, when am I going to get this symptom?
Yeah, and they worry if they don't get it.
Yeah, my friend got this, but I'm not getting the symptom. Does that mean I'm not pregnant anymore, or whatever that might be for them? So,
sure.
Yeah, we're going to go through that.
Good.
But first, Pat, I do want to talk about a review that we got from somebody. All right. Dear Dr. Pat and Brigid, I wanted to thank you for your podcast and your pregnancy course. I have found your resources super helpful and very informative. I'm so glad I signed up for your online training too. Knowledge is absolutely the best tool for pregnancy and to be prepared for labour and for everything else that can come with it. I'm very grateful I have come across your resources. Thank you.
Nice.
How lovely is that?
That's what we're here for.
So that came through a DM on Instagram, and I just want to talk about a couple of comments that have come through on Spotify.
Good.
So these are all in relation to the miscarriage episode. So that's way back in episode 27. So It's one of our most listened to podcasts, actually.
Yeah, I think it's a good one. I think that's an area where knowledge is lacking.
And actually the title's called The Common Pain We All Share. And Brooke Meister said, thank you so much for a wonderful episode. I recently had a miscarriage and this was so healing to listen to, and hearing others' stories made me feel less alone. The next one from Chris J. Greening, who said, this podcast is really helping me and I thank you both, with a love heart. Oh, nice. And one from Shy said, thank you for this podcast. I miscarried last week at just under 6 weeks and it's been such a roller coaster. While family have been extremely supportive, there have been comments around at least it wasn't a fetus yet. It would have been harder if it happened later. People just don't realise that sometimes less is more.
Yes.
Thank you so much.
Did we include a thing in that on what you're supposed to say to other people? Yeah. And saying it wasn't a proper baby yet is definitely the wrong thing to say. And so non-pregnant people could have a look at that, because I think we included some suggestions of what to say to somebody. So not ringing them, not contacting the person at all if there's someone you love is the wrong thing to do. So you know you're supposed to do it, but then you don't want to say the wrong thing.
Yeah, so you don't do anything.
So going in armed with a miscarriage informed correct thing to say is a great idea.
Yeah, we've also got something in our program that you can just print out.
Yeah.
Send along.
Yeah, read it as a script. Just say this.
Yeah, because, I mean, we've all got a bit of foot and mouth. Like, it's very hard. But perhaps my tip would be just get 1 or 2 things in your memory bank that if you're ever faced with that situation where a friend's just told you that they've had a miscarriage or something, you can say that. It's there in your memory bank and you can say that without thinking, oh, my God, I'm going to stuff it up. I won't say the right thing.
Yeah.
Yeah. So thank you. I like reading those out, Pat, because people have taken the time to contact us and are really thankful for the work we do. And
we appreciate the feedback.
Yeah. One of the reasons why I wanted to do this is because we've recently, have a family member she's pregnant. She's saying, I don't have this, but then I had it and then I didn't have a symptom again. And then I thought maybe I'm not pregnant anymore.
Yeah, that's a tough one, isn't it? When you got something and then you think when it goes away, which everyone thinks, it's good news. You're not barfing anymore. But then you start thinking, maybe I should still be barfing.
Yeah. Maybe I'm no longer pregnant.
Yeah.
Or my friend had this symptom and that was a sign of her being pregnant and I have never had that. Or and in fact, I was just talking to somebody in our clinic today and she was talking about how she's had 4 Caesars now and how each one of those Caesars has been amazing. And she's like, I don't know, like before I had my first Caesar, all I heard and saw were terrible stories about Caesars.
Oh, yeah.
Yep.
Yeah.
And she's saying like maybe people don't feel like they can talk about having a good Caesar.
Oh, yeah.
Yeah. And it's a bit like that in pregnancy. Sometimes you feel like, well, you can't say that you didn't have many symptoms or, seems like a humble brag or something.
Okay.
Anyway, so we're going to talk about lots of symptoms. You may or may not have any of them or lots of them or all of them.
All of them, maybe.
Maybe you've got all of them. All right. What is the most common symptom that you see that everybody will talk to you about?
Well, the most common one people are aware of and talk about is nausea and vomiting. Mm-hmm. Yeah. And so it's interesting, though, is that not everybody gets it. Probably 3/4.
Yep.
Yeah. A quarter of people say that they don't get any nausea or vomiting, which is interesting. But in my experience, just about everyone gets tiredness. So first trimester sort of exhaustion, I think, is more common than nausea and vomiting. Yeah, almost universal compared to about 3/4 of people experience nausea and vomiting.
And with the nausea and vomiting, I mean, more and more because I'm in the clinic a lot more these days, a lot of people get it all the way through pregnancy.
Yeah, they do. But, well, look, some people do get it right the way through, but not many. Some of the people who get it right the way through have often got a condition called hyperemesis, which we've discussed before elsewhere. And then some people just get intermittent, mild to moderate nausea and vomiting that happens right the way through. Doesn't rise to the level of a diagnosis of hyperemesis gravidarum. It's not associated with malnutrition or dehydration, but it just keeps coming back.
What about tender breasts, the old sore boob? Does that happen to everybody, and when does it happen?
So, yeah, breast tenderness is another one of those really common ones. It's mostly a first trimester thing. Some people, that's how they find out they're pregnant, is that they notice a distinct change in the way the breasts feel to them. But that one typically goes away after the first trimester, but not in everybody. Some people continue to experience that. When we get a lot of breast pain later in the pregnancy, that's usually something else and needs to be sometimes it's a form of mastitis that's experienced by the woman as the milk ducts start to form. And occasionally a full-on proper mastitis can happen while you're still pregnant.
I'm going to put in my little tip here, and that is don't wait to get the maternity bra. Just get it early. It really does help increase the comfort because your breast shape and size is changing.
Sure.
Everybody talks about the pregnant woman needing to go to the toilet a lot.
Yeah, urinary frequency. I think that's how you knew you were pregnant, wasn't it?
No, mine was barfing into the neighbour's garden.
Oh, right.
Yeah.
Okay. No. I'm pretty sure that's how you knew you were pregnant.
Not for the first one. I remember the first pregnancy for sure was I smelt something off and walking to work one morning and I vomited into my neighbour's garden and thought, that's unusual.
Yeah, I just remember though when you woke up in the middle of the night and you needed to go that you thought, hang on a minute.
That's unusual behaviour for me.
Yeah.
Oh my God, I have totally forgotten that memory.
So that happens and that is, I mean, the hormones are powerful things. Yeah, you don't need to have much of the pregnancy hormone in your body for it to start to disrupt all sorts of body's functions and rhythms.
I didn't remember having to pee tons at certain points in the pregnancy. Like it sort of came and went a little bit. But what I did notice was a lot of bloating, farting, constipation.
Yeah, disruption to the gastrointestinal tract is really common as well. So constipation is extremely frequent, common. And I find myself talking to people about constipation a lot And there's probably people who've got bad constipation who don't want to talk to me about it, but the ones that do, it's treatable. But you can't. There's nothing you can do about the underlying pregnancy hormones that are provoking it. But most constipation treatments are safe for use in pregnancy. Yeah. And it's not as easy as saying drink more water, because then you urinate more and they create a new problem. So you certainly should be drinking water, but there are other easily available pharmacy treatments for constipation that are safe for use in pregnancy.
And if our dietitian or physiotherapist was here right now, they would say a squatty potty.
Yeah, but that's different. That's for different reasons.
Hit that arvo slump and fighting to refocus? Everything feels harder than it should. I'm Claire Murphy, and this is Well, your weekly wellness reset. No fluff, no fads, no woo-woo, just clear, expert advice to help you bounce back to your best. So whenever you need a second of self-care, join me and our resident GP, Dr. Mariam, for real talk on our bodies, minds, and how to live a healthier life. Listen now, wherever you get your podcasts.
All right. Does everybody, do you think, do they report food aversions or cravings or, this is such hit and miss, isn't it?
Yeah, cravings, I don't think so. I think the cravings are way less common in my experience than you would think from the movies or something. But food aversions happen all the time, and that's weird because probably the strongest ones that people frequently report is that the smell of meat cooking grosses them out. And that's unfortunate because iron's good for you in pregnancy. The baby's stealing it. And even though you're not menstruating, getting iron deficient in pregnancy from losses into the fetus are pretty common. And not everyone's a good iron absorber. So we use a lot of infusions to bypass the gut and put iron straight into a vein. Meat is a very bioavailable source of iron. We're pretty good at getting the iron out of meat, and so if the smell of it cooking grosses you out, that's unfortunate and a little bit counterproductive of your pregnancy. But there you go.
I know that in our iron episode we talked about iron infusions, but I just wanted to pick up on some sort of media trends where people are saying that they're a bit scared of having an iron infusion and they're, taking iron tablets instead or whatever. And that in itself is a bit of an issue if people are avoiding iron infusions.
Yeah, I think if you've been advised to have an iron infusion in pregnancy, then that's something you should look at and not be afraid of. It certainly doesn't have safety problems. It's quite a whack of iron, but when you bypass the gut, you don't get the gut side effects of taking that much iron. And it'll bring your iron up to about a year's worth, which is pretty handy not to have to worry too much about iron balance from that point onwards or for about the first year of breastfeeding. And it's the modern ones are extremely well tolerated. When I was a junior doctor, we didn't used to use many iron infusions, even for people with cancer and various other things, because they used to hurt to give. It would really hurt going up the vein. And the modern ones don't hurt.
And take, 40 minutes or something? Yeah.
Yeah, about 20 minutes to give and 20 minutes of observation. Yeah. The problem is that if you've become iron deficient in pregnancy, which is pretty common, it's not like you can easily bat your way out of that position. You're still pregnant, so the baby's still stealing a lot of it. And even though you're not menstruating, you don't have those losses, you may not be absorbing it very well from the pregnancy multivitamin, from meat, from anything, because if you were a super good absorber of iron in your small bowel, you probably wouldn't have got deficient in the first place. Yeah. So we're probably dealing with people who aren't great absorbers. And also, the amount of iron that can be absorbed from the small bowel in one day is kind of fixed. So if you take an iron tablet plus the little bit of iron that's in your pregnancy multivitamin, that's about as much as your bowel can manage, and there's no point in taking multiple extra ones. Yeah, you wind up with more side effects, but not necessarily more iron.
Another really common, I'm going to put it all into a big bucket, is all the the joint pains, the ligament pains, the mild cramping, that for me, that was a big symptom of my pregnancy, probably more in the early stages.
Yeah.
But and then in the late stages as well. So how common do you think they are?
Near universal to get musculoskeletal pain in pregnancy. Everything changes so much. The elasticity of joints and ligaments, how much you literally weigh, how active you can be, how good your sleep is, and how much you can engage in in whatever exercise used to suit you before you were pregnant. So it's a no-brainer that you're going to get some musculoskeletal dysfunction at some point in the pregnancy, and everybody gets that. We are big believers in pregnancy physiotherapy at our clinic, and so we really encourage everybody as part of the deal of coming to see us is to have at least one visit with a pregnancy physio, because you might not be able to do the things that you can normally do, but you can do other things, pregnancy-specific things, advanced pregnancy-appropriate things to keep your body moving. Yeah.
And I definitely still want to do another episode about exercise in pregnancy, because the new guidelines came out, in Canada, saying how vital exercise in pregnancy is. It's probably, key to a healthy pregnancy.
Yeah, I think, to so many things in a pregnancy, but also to address the issue of cumulative weight gain per pregnancy. Yeah. And some of that is about never returning to pre-pregnancy levels of exercise.
Yeah, right.
Yeah. So it's one of the ways in which not just women, the whole family can wind up with gaining weight is not addressing weight reduction between pregnancies. Yeah.
Now I want to talk about a symptom or a sign of pregnancy that isn't, it isn't major, but a lot of people do stress and worry about it, and you just get skin changes and you get spots where you didn't have spots before, and you get darkening bits, and How common are all of those?
Yeah, really, really interesting one. So some of the placental hormones can change the colour of your skin. And some people get an overall darkening of the skin. Some people just get that black line or that brown line that goes up and down their tummy. And other times people experience that as a change in the colour, size or shape of moles.
Yeah.
It's reasonably common. And I get shown all sorts of skin lesions, and sometimes I know what I'm talking about and sometimes I don't. And I have sent some people to dermatologists for things I haven't liked the look of. Yeah. Because we tell people to bring a mole to the doctor's attention if it's changing. And then if it changes in pregnancy, it's not always benign. Yeah. I've seen a couple of melanomas.
And Pat, when in the pregnancy? Does that happen at any time in the pregnancy?
Any time for that one. Yeah. Yeah, they're placental hormones, so they're there for the whole show.
What about swelling? Like, I remember only in one pregnancy I had terribly swollen ankles by the end of it, but it wasn't in the other three. Like, how common is swelling?
Yeah, I think that's an interesting one. I think probably swollen ankles.
Cankles.
I think everybody retains some fluid in pregnancy. It's just that the amount that's retained is often not visible. So if you look at your ankles, perhaps in the third trimester, somewhere around a third of people have got of women have got some swollen ankles. It's harmless. It's just part of being pregnant. It's one of the things we look at if you've got high blood pressure. That's different. The combination is worrying, but on its own, it's okay. There's also a retention of fluid in the arms. It's just not as obvious. So if you've got some fluid in your wrists, you don't get swollen wrists, but you do get that pregnancy carpal tunnel. And there's probably fluid down near the nerve as it comes through the carpal tunnel and into the palm of your hand that explains that symptom.
We actually got a question a little while ago about carpal tunnel, and I realised we haven't done an episode on that. It is in our program. We've got our physiotherapist as a special video with that. But could you just quickly tell people what carpal tunnel feels like?
Yeah, so carpal tunnel is compression of the median nerve as it comes down through your wrist and into the palm of the hand. And it's mostly seen in older people, isn't it? 60-plus sort of diagnosis, and where the nerve is getting compressed by a little bit of osteoarthritis in the wrist. But there's a pregnancy version where hormonal changes and fluid retention compress the nerve temporarily during the pregnancy. Because it's hormonal, it doesn't need a operation. It just needs to be tolerated. And there's an operation for the older people who get it where they open the carpal tunnel and release the tension, and the nerve can move more freely and function more freely. When you're pregnant, we don't do that because we know you're going to be probably cured after your pregnancy gone away anyway. Yeah. Unfortunately, there's no great way to relieve the symptoms that works terribly well in pregnancy. If you're an older person with carpal tunnel and the basis of it is arthritis, then you might do well with a wrist brace. But because that's not the basis of the pregnancy version, the bracing doesn't seem to help much. And similarly, trying to get rid of the fluid, you can go to sleep with your ankles up, and in the morning your ankles will be smaller with gravity. But it's hard to go to sleep with your arms up in the air. Yeah, so the minute you're asleep, they just drop back down. Yeah.
Oh, so it's one of those ones, a bit like hyperemesis.
Tolerate.
It's just, the baby has to be out.
Yeah, well, hyperemesis we can treat.
Yeah, true.
The carpal tunnel, it's tolerate until baby comes. Yeah. It tends to, in most cases, it goes away pretty fast. Yeah. Not immediately, but when the placenta's out of your body and the hormonal environment returns towards non-pregnant state, the circulatory changes happen pretty fast. A lot of women in that first couple of weeks after having a baby notice that they're urinating more, and that's the excess fluid coming out.
Oh, your body's amazing. Yep, just trying to get that equilibrium again.
Yeah.
Yep. So how commonly do you see carpal tunnel?
I would say 1 or 2% of pregnant women would have a significant problem with that. 1 or 2%.
Yep.
In my experience, I'm not sure what the textbook answer to that question is actually, but I'm just thinking across my practice, perhaps 1 or 2%.
Yeah, and does it happen at any particular time in the pregnancy?
Or worse towards the end.
Yeah.
Yeah.
All right, I'm going to talk about another skin change, which is stretch marks. Now, I know that isn't anything that you can do anything about,
No.
but how common is it? It's pretty common, isn't it?
Yeah, that is pretty common. Not universal. I've never really seen any way of predicting that. Is there a skin type or whatever that's going to predict it? I don't think so. But some people get some subtle stretching of the skin, and others get that really angry, bruised looking stretch marks, and I think that's it's part of the deal. Yeah.
Wear them with pride. I got pretty angry, sort of purpley stretch marks in my first pregnancy. You can't really tell that I've got it. Just it has made my tummy look a little bit white and crepey, a little bit. But who's looking?
I am.
You are. But there are lots of stretch mark things on the market. They keep coming and talking to us about it. One day we'll find out whether they're any good or not.
Whether they work or not. Yeah, I don't know.
Yeah.
Parenting podcasts can be a bit earnest. Parenting Out Loud is not that podcast.
This person who I may not agree with politically is trying to talk about integrating children, not just into his professional life, but into public life.
I have referred to myself as one and done. That article did make me rethink the term.
It took about 11 seconds for this to go viral.
Oh God, is this the ejaculate one? That is deranged and I love it.
Parenting changes the way you see everything. Parenting Out Loud takes the big conversations of the moment and puts them through that filter.
Because if parents are thinking about it, we're talking about it.
Parenting Out Loud. Listen weekly wherever you get your podcasts.
What about the old sleep disturbance? When does that happen in a pregnancy?
Well, I think from the start.
Sorry, folks.
For hormonal reasons, and then at the end for musculoskeletal discomfort reasons. Yeah. So fetal movements and musculoskeletal pain will wake you up, a dozen times a night at the end of the pregnancy. But some people get a form of sort of sleep disturbance at the start or right the way through, and it's normal. What's not normal is sleep disturbance as a symptom of severe depression. So if somebody wakes up in the middle of the night and at 3 a.m. and feels wide awake and can't get back to sleep, that's a significant disturbance to that person's biorhythms. And it can be a symptom of depression. If that person says, I'm not depressed, I feel totally fine, I just get up and do something, and eventually tired sleep cycle comes back around and I go back to sleep, well, that's fine. That's just a pregnancy disturbing it. But it shouldn't be missed as a potential red flag for severe depression.
That's a good point to raise. If anyone is listening to this and is either perimenopausal or menopausal, sleep disturbance is one of the biggest symptoms.
There you go, it comes back.
It comes back. All right, what else? I want to talk about, hemorrhoids. Good old hemorrhoids. Are they very common?
Yes. If you've already got hemorrhoids, they're bound to get worse. If you don't have any, then you may experience it for the first time in pregnancy. Again, it's a placental hormone effect on those easily dilatable veins near your backside. Mostly, it's a fact of pregnancy. It's okay. Occasionally, they flare and become very painful. Very rarely do they need attention from a colorectal surgeon in pregnancy. A couple of times ever have I referred people. And even then, they've been loath to do an operation in pregnancy and concentrate on things like cortisone and local anaesthetic creams, ice packs, and so forth. Yeah.
Every woman in my family, so there's 4 girls and my mum, have all got varicose veins in their legs.
Yeah.
Except me. I got hemorrhoids instead. I kind of prefer the hemorrhoids.
Yeah.
How vain is that?
Yeah, how vain. Yeah, it's nice.
Vain.
No pun intended.
No. All right, I want to finish on bleedy things like nosebleeds, bleeding gums. Like, how common are they, and is there any particular time in the pregnancy that would occur?
I don't think that there's a particular time for that. I haven't noticed a particular time for those, but there's no doubt that placental hormones dry out the nasal mucosa, and you get more nosebleeds, and you're more likely to cause a bleed if you pick your nose. So don't do that.
Or sneeze.
Well, yeah. So if you bleed from a sneeze, it's dramatic, but it's typically not harmful. Trick is just to recognise those, squeeze the soft part of the nose, lean your head forward, and wait till the bleeding stops, and then don't do anything to provoke it. Yeah, bleeding gums happen, and it is not a sign necessarily of poor dentition, and it's not a sign that you should stop brushing teeth.
Yeah, and actually, we're going to get a dentist on very soon. So send all your questions in about any tooth issues or gum issues that you have during pregnancy or anything that you're worried about.
Yeah, good point, because they're the experts, and we want to hear from them about the safety of dental treatment, not delaying treatment, even if you've had a lot of dental issues. Should we be going for a checkup before we get pregnant?
Great. All right. Well, I'm going to leave it at that, Pat. I think the thing that I've most got out of this is every single symptom you may or may not get.
Yeah, you can't predict it. Yeah,
you can't predict it.
Yeah.
There's no rhyme or reason.
Yeah, and if you've got it one day and you don't have it the next, that doesn't mean anything's gone wrong. A lot of these will come and go.
And also, you can't be sitting there waiting for them either. No. Because they may not ever happen to you, So sometimes I'm waiting for the other shoe to fall, and yet it's been a mental process of trying to teach myself to just accept that, everything right now is going okay.
Good.
Yeah. All right, everyone. Thank you so much for tuning in to our podcast. We love putting them together for you. If you've really enjoyed this episode or any other episode, please share it with a friend who's either pregnant or thinking of being pregnant. That's how the message gets spread, and that's how more people can be educated just like you. So well done for being informed during your pregnancy.
Thanks for listening, everybody.
Thanks, everybody. Bye for now. I just need to remind you that this podcast is for informational purposes only. We share lots of medical insights and experience, but everything we talk about is general in nature and may not apply to your specific situation. Please always consult with your own healthcare provider for your individual medical advice when you grow your baby.
Struggling with the anxiety that comes with adulting?
Or maybe you've suddenly become the parent to your parents.
Wondering if you might have ADHD, but unsure if or how to get a diagnosis?
I'm clinical psychologist Dr. Anastasia Horonis.
And I'm Ashani Dante. We're your hosts of But Are You Happy?
Bringing you all the self-development and mental health information you actually need.
New episodes drop every Saturday morning.
Just in time for your hot girl walk.
So tune in to But Are You Happy? The podcast where overthinking finally gets the spotlight it deserves. Made in partnership with Medibank.